Evening, Colorado. Jason Crow here. Thank you so much for joining us in the next installment of our virtual job series and webinars to help the community navigate the challenges of the coronavirus pandemic, both the health challenges and the economic challenges. As many of you might recall, last year we held the first ever Congressional District 6 CD6 job fair. And we had over 1,000 job seekers connect with over 60 employers from throughout the community. And we helped connect dozens of people into new jobs to help take their career to the next level. We were planning on doing that again this year, but unfortunately the pandemic does not allow us to have everyone come together under one roof to do that. So we wanted to think of a new way to provide this service and to help people address the crisis when we need it more than ever, when we're seeing unprecedented levels of unemployment and health issues throughout the community. So we came up with the idea of doing this virtual series that does a number of things. We've had seminars on resume skills, interviewing skills, looking at new jobs, making the transition to new jobs, and a number of things for both businesses and employers. We have a special guest who's going to talk to us tonight about how to safely reopen businesses. But before we do that, I want to give you a very quick update. I'm in Washington this evening, and we're working really hard to try to negotiate with the Senate an extension to unemployment benefits, more money for stimulus for local communities, for our schools, and for testing and development of a coronavirus vaccine and treatment. This is critical. We are in a severe crisis, both health and economic, and we can't short shrift this. We have to make sure that we're addressing this with the urgency in the boldness that it deserves at this time, and we're working hard to try to deliver for the American people and for the people of Colorado. So with no further ado, I'm really excited that Melissa Sager with Tri-County Health Department is joining us this evening to talk about a really important topic, and that is how to safely reopen your businesses during this health crisis. And what are the considerations and the things that you should be thinking about? Because one thing we know is true, and that is you cannot separate the health crisis from the economic crisis. Some people want to talk about, how do we just deliver aid for businesses? How do we just deal with the health thing? The two issues are linked because so long as people don't feel comfortable going back to work, so long as people don't feel comfortable going to restaurants, going to businesses and shopping, if they do not have that confidence and if people are not healthy, then our economy cannot be healthy. So how do we do both at the same time? A really important topic. Melissa Sager with Tri-County Health is here with us tonight to talk about it. So Melissa, thank you for joining us, and I'll toss it over to you.
Yeah, thanks so much, Congressman. We're happy to be here. And honestly, it really is exactly what you just said. Working with businesses to open safely. We know it's great for businesses and it's great for health, and we've had some really fantastic success. So with that, I'll jump right into the presentation. Thanks so much for having me. I'm going to start with just a little bit of background on how the system kind of works behind the scenes, just so folks have an idea, because it gets a little confusing when you have the governor saying some things and the state health department, and then you have your local health department, that's me, and then you have your locally elected officials and your congressional representatives. And so it gets a little bit confusing, but what we've seen very generally is that we have the governor issuing an executive order, and his executive order directs the state health department to issue a public health order. And the public health order usually has all the details. So the governor's executive order will have the general outline of the requirements. We need a safer at home order, and it needs to do this, this, and this. And then we get the state health department order, and that has all the details for all the requirements, from everything to cleaning to how many employees you can have, how many customers you can have in your business. All those details are generally included in the public health order, and that comes from the state. Your local public health agency can also issue public health orders that are more restrictive than the state. So we can't issue anything less restrictive. So when you're talking about businesses, your local health department, Tri-County Health, cannot say, we're going to allow these businesses to open even though the statewide order says it's not okay. So, but we can do things more restrictive. Recently, you may have heard about our masking order. So the Tri-County Health Department issued a local masking requirement. And then the state just a few days later issued a masking requirement for the whole state. So Tri-County aligned our language with the states, so the requirements are the same, but we left an additional requirement in for outdoor activity where 6 feet can't be maintained. So it's a little bit stricter and just builds on the state order. So these things generally change at the state level, and your local health department, Tri-County, is coordinating between the state and our communities, whether it be with our elected officials or our businesses themselves. And we do that in a variety of ways and through a variety of channels. I'd encourage you to check out your county government's page. We do a lot of town halls. Right after this webinar, I'll be jumping on an Arapahoe County town hall. So I'd encourage you to jump on that. Lots of good information from a lot of different experts. We do these webinars with all of you here. We do weekly webinars through our Business Reopening Task Force, where we provide technical assistance to businesses as they reopen. And I'll provide a little bit more information on that in just a bit. But that's the general structure. So lots of things coming from the state. Locals can do stricter requirements, but not more lenient. And we really serve as an in-between for these requirements from the state and then really enforcement that happens at a local level. So we are tasked as the enforcers of the statewide public health orders. So that's generally why you hear from us, but the requirements are coming from the state. So I'm going to do a little bit, I am going to share my screen here just to do a little navigation with you, because rather than walking you through everything without any kind of visuals here, I'll be able to show you what I'm talking about. So this is the Colorado Department of Public Health and Environment's website. Their homepage is covid19.colorado.gov. It looks just like this, and it's a really fantastic resource for both employers and employees to check out because all the updates are here, all of the requirements. If you click around, you can find a lot of great information, templates, and I'm going to walk you through a little bit of that right here. So this is the main page, as I mentioned. If you scroll just a little bit to the bottom, you'll see regular updates here. So this is the most recent information that's come out from the State Health Department. Again, your local government is following this. Guidance for schools just came out, and the mandatory mask order was the most recent information here. So all of these things are relevant, but I want to touch on some of the guidance for businesses, just where you can expect to see changes, how you can follow along and stay informed. And not only through these channels like this, but just regularly on your day-to-day, being able to access this information, just empowering all of you with that. So from the main page, we have safer at home and in the vast, great outdoors. This is the phase of reopening that we're in. The next phase is protect our neighbors, and I'll show you that at the end. But just walking through, these are going to be your current requirements. And I'm going to touch on best practices for all businesses first. Just walking through some of these general requirements. So this is for essential and non-essential businesses. So it's for those businesses that have been open all along. It's for newly opening businesses. And it's pretty detailed here what we're looking for. But at the same time, it builds in flexibility. So you'll see we're looking for you to deputize a workplace coordinator. And so as an employer or an employee, you want to know that someone on shift there is in charge. So should something happen in the workplace, and just someone who can handle those situations and coordinate. And so there are lots of great guidance documents and training documents for employees and employers to use. And so we try to make it less difficult, but your local health department is available for guidance along the way. So as you access these resources, as you hear something online, live video stream from Governor Polis, somebody's tweeted something, You've heard that this business is allowed to do it, and why can't you? These are all questions that we're happy to chat through with you through our business reopening task force. I'll just mention that email address really quickly. It's covidbusinessrecovery@tchd.org. We have staff dedicated to answering all kinds of questions, really with a goal of accommodating unique situations, business practices, employees. We know that a public health order couldn't possibly encompass all of the requirements and touch on all of the businesses and unique activities or unique employees in those settings. And so we're here to bridge that gap between the information we're getting from the state and then practically implementing it. Again, whether you're an employer or an employee, here to support you. So deputizing a coordinator, really having someone available to answer those questions that come up and deal with anything urgent. A call from the health department, an employee got sick, just someone in charge of those issues. 6 foot distancing, a lot of this is going to be what you've heard already. Staying 6 feet apart, it's the same in the workplace. Posting signage, and I'll just posting signage here. It's even more than this. Really communicating. As an employee, you want to know what is expected of you on a regular basis. What are the standards? They're all different and changing frequently. And so you want to be able to feel like you're doing things properly and safely. And really there's some onus on the employers here to provide some of that guidance. And so really encouraging employers to reach out so that we can help you find those materials that you need, help to train your staff, make sure you're on the same page, and really regularly. We're available Monday through Friday, 8 a.m. to 5 p.m. We have folks on call. So we're here all the time to answer these questions and really walk folks through what's required. Avoiding gatherings of 10 or more, keeping things small. You know, you have an all staff meeting, you don't all need to be in the break room at one time. Can you transition those virtually? Can you do them on the computer before work? Keeping people apart. Sometimes it really doesn't feel intuitive to what we're used to when you're in the work setting. Having an all staff meeting when you know you're gonna be there in the building. But this is really what we're looking for here. Whether you're in retail or an office space or manufacturing, we don't want people all in the same room at one time. It really creates issues and risk of spread. And so some of it really is different than what we're used to, may not feel as comfortable, but really keeps folks safe. So taking that extra step to even suggest an innovative approach, take it outside whenever you can, all different kinds of things that you can do to just decrease that risk of spread in your setting. Symptom monitoring is a requirement for all businesses. So just for employees, knowing that your employer is required to symptom screen you before you come to work in person, and employers' resources here for you to set that up. So you'll see throughout when I click on a few more of these things, there's lots of links. So this is additional guidance specifically for symptom screening. And when you open it up, it links you to all the guidance, a video on symptom screening, what equipment, personnel, setup, explains all the requirements, template documents here for what symptom screening should look like. I'm just going to open this up really quickly for you all because it is really trying to make it easy on folks. And we know things are changing. We know things are complicated. It's not as straightforward, but we try to put these supports here and then filling the gaps with technical assistance along the way from your local public health agency. Symptom monitoring, eliminating regularly touched surfaces, any common areas where folks would gather, anything that people touch regularly. You want to increase those sanitation processes that you would use regularly, do more, the bathrooms, even closing off areas where you can. So if an open seating area in a lobby or your waiting area in a restaurant, those aren't necessary. keeping folks outside when you can and closing those areas off. We're really looking for folks to operate by appointment only to the greatest extent possible. So you're not getting unexpected people in your building that would need a waiting area. The folks visiting your restaurant or office have an appointment to be there, looking for very controlled movement and comings and goings, both to prevent contact as folks are coming and going, but also to enable contact tracing should there be an issue. So we want to be able to reach out to you and you know exactly who is in your building. For restaurants, looking for a sign-in for customers as an option for contact tracing. We know not everyone wants to share that information, but whenever we can reach people quickly should there be an outbreak, giving folks an option to do that. Providing appropriate protective gear. We work with businesses to figure out channels to obtain this. We know masks may be in short supply or hand sanitizer, although we're seeing these come back. Helping you navigate how to obtain those, reassuring you when they're not in stock that it's not you, they're not available right now. And oftentimes we're facing the same issues in our office spaces. But just being a sounding board for those issues, talking you through how to open, how to stay safe while you reopen, resources for employees, and I'll touch on that in just a second. For employees, a big protection here, we want folks to stay home when they're sick. And so there are requirements to provide paid leave for folks who are sick for short durations, both federally and at the state level now. And so we're looking for employers to provide that leave when folks need to stay home. We don't want any incentive for folks coming to work sick. And so anything we can do to reassure people that it is good for them to stay home and assure employees that they have that ability with no repercussions. In addition to these required paid leave, and I'll provide my contact information at the end, and I'm happy to provide more if you have questions. We're looking for flexible work policies. So if your employees can work from home, if you as an employee can do your duties from home, we want everyone who can work from home to be doing that still. While we're seeing increased openings, we are still looking for folks to minimize that movement to the greatest extent possible. So I'm in my home right now, working from home, and just doing that whenever possible. So if you as an employee have some concerns, we are happy to provide resources to your employer about what that looks like, what some of the requirements are for reasonable accommodations, what kind of flexible work policies could be put in place. And there's a lot of new guidance out for this. So if you or your employer have questions about that, we're happy to chat through. And I said these encourage remote work, minimize in-person meetings. So a lot of these things are basic and haven't changed at all since the beginning. You'll notice that these are just some of the basics: cleaning a lot, staying apart. That's where those flexible leave policies come in, work from home. You know, it's not how we usually operate, but this is the requirement for everyone. Even as a government agency, the local public health agency, we're still working from home to the greatest extent possible and really encouraging all employers to do that. We do know that some industries cannot work from home, and so that's really where we get into some of this additional guidance for the workspace. So safer at home and in the vast great outdoors, guidance for businesses, and I'm going to go down here to resources. And you'll see that I'm skipping a bunch of these. We did talk about how to screen for symptoms, so I did click on that. I'm going to go back to employees and customer safety, but I'm going to touch on resources now. There's a lot more here that I couldn't possibly cover in this time, but I really encourage you to check out the website for some really interesting resources. I'm going to touch on a few here. So we have workplace outbreak guidance. This is a question that we get a lot at the through the Business Reopening Task Force. What do I do if an employee tests positive? We do get questions from employees as well. I know that a coworker of mine tested positive. why isn't my office closed yet? Or why isn't my retail establishment closed because 2 employees have tested positive? This provides some guidance, and I'd encourage employees to check it out too, geared toward employers how to respond, but will give you an idea as an employee what you can expect. I will say here, though, that this is really situational specific. And so we have teams of investigators and contact tracers that really thoroughly have conversations with folks who have tested positive and business establishments if they need to. It's just based on how much contact was there, what the activity looked like, how separated someone was. And so it's case by case, and oftentimes your business isn't going to close down right away because of one case, or your coworker got sick. It doesn't necessarily mean that you should stay home. It's so specific. And so check out the outbreak guidance. There's a lot of resources on here for individuals as well when it comes to what you should do if you're sick or you think you've been exposed or have been. And so really check out this state website here. I'm going to show you Tri-County's website too, but just in the interest of time here, going through the state guidance. Cleaning guidance, worker and consumer protection, masks and protective equipment. Some of this is, you'll get the basics here, why wear a mask, how you need to wear a mask, other tips. Some of the guidance is a lot more technical, like when it comes to worker and consumer protection. It's going to get into a lot of text and details here. You'll see here lots of different, depending on the industry that you're in, agriculture, even guidance for grocers, municipalities, public transportation, farmers markets. So just trying to promote this. So as you, as a resident watching this video here, pass it on, that there's a lot of resources here. We know it doesn't always get out effectively. We do our best, but you all can be messengers as well. So please reference this page when folks have questions. Restaurants and food manufacturers, schools and childcare, lots of new guidance coming with schools. So this is a great resource, lots to read up on, better understand what to expect should something happen, but a lot of great resources. I want to quickly touch on keeping employees and customers safe. This was one of the topics that I had on my list just to touch on, because I know that we are talking to employees on the line here. So really focusing on how to keep your workspace safe, to keep you safe. We talked about a lot of them. A lot of them are required here, but really focusing on how you can keep employees safe here, tips for workers specifically, so you as an employee. And this is stuff that we're looking to connect employers with to train folks. So as an employer, you should use these resources to communicate with your employees. And a lot of these have translations here. So folks with employees or employers needing different languages, this is a great option to connect your employees with information. So not looking for anything fancy with training, really looking to connect folks with this information right here. Print out this page and make sure your employees are connected with it to know what's expected of them at different times and in different situations. And as an employee, just being able to check this out yourself and feel confident that this is where we are. Making sure you're checking that homepage for updates, because they come sometimes hourly, making it difficult to keep up, which we know. So keep reaching out. I'll mention the Business Reopening Task Force again. They can be reached at COVID Business Recovery at tchd.org. Happy to answer any questions that you have. All right, I'm going to quickly touch on Tri-County's website here. Let's see. When you go, it's tchd.org. At the top here, you have COVID-19 updates and resources. Some of those main ones are on that main page there. And then you can navigate to our resources here. We have a lot of the same resources as the state. We link them here should you come to our page instead of the state. So you can pull together resources here. We do have some unique resources specifically for businesses. So that's what I want to touch on really quickly. This is our business page. We have our how to connect. We do weekly webinars, so feel free to jump on those, chat in your question, talk in your question, chat with us. The whole task force participates, well, not all at once, but we participate throughout. And so we're happy to talk to you live during those webinars and encourage you to join those. Again, tchd.org, and you can quickly navigate to the COVID and business updates. We have a lot of guidance documents here. Some of these are unique to our jurisdiction. So we have our best practices for all businesses. We talked about that. But we also flag some resources here from outside organizations. So this is CPRA, Colorado Parks and Rec Association. We have guidance for car washes. We have a lot of car washes in our jurisdiction. And so we got a lot of calls, and this is really an advertisement for all of you. You help us guide our guidance documents and what we focus our time and attention on, because we are trying to be responsive to your needs. That's what we're here for. So that's how car wash guidance got on our website. And we do go through and talk to the industry. We worked closely with the industry on what their business model looked like. You know, we're a agency. We're not necessarily car wash experts who know. And so this is where you all come in to hear from you about what your business model is, how it doesn't work, how it's not a great fit. You're not sure if you exactly fit under this. Is your business model complying? That informs the guidance documents we put together. But it also informs our communications with the state. So can we advocate on your behalf? This isn't working in this space, and have we thought this through? So we have regular conversations with the state health department, with representatives from the governor's office, with school superintendents, with gyms. And so just connecting the dots and making sure that your voice is heard. Because again, and just like we talked about at the beginning, the public health orders just couldn't possibly address every single situation. And so serving as that bridge, filling the gaps with car wash guidance, and answering your questions along the way is really what we're here to do. We have DORA, spas, symptom screening, again, some of these connected to state health department guidance, more unique ones, guidance for drive-in events, small event guidance. We've heard a lot from the community with a need for this. What does a small event look like? And this can be whether it's for you personally or within your job setting. We're allowing these larger events to take place, still small, restricted, but larger than 10. And what does that look like? Whether you're a caterer or a restaurant hosting someone, or a venue, or it is your own backyard, just connecting you with some practical guidance here on what small events can and should look like. And just as we said for businesses in general, communication across the board here, that's what we're looking for. Same for large events. We want to know people are informed. We want to know people are taking intentional action to keep folks safe. And so as an employee, you want to hear that from your employer, that they're taking intentional action to keep you safe. And that's what we're looking for across the board, really. And that's what this talks about here. I like to bring up the small event guidance because it says things like, you know, maybe don't pull out the yard games this time, and have folks bring separate chairs. We're talking really practical. But that's what we're looking for in the business setting too. What can you practically do as an employer or employee to keep folks safe? And when it doesn't match up with guidance here, having you all reach out to us so we can say, could we tweak it a little bit? Can you make it more like this to match up here? Or have you thought about doing it this way? And it's really conversational, again, because we're not the subject matter experts in your business. And so to hear that feedback from you and ultimately relay that message to the state is the goal. So Lots of different guidance here I encourage you to look through. And then the last thing I want to touch on before we get started with questions, because that's really what I'm here for, to hear from you, is our data. This is Tri-County's, no matter where you go on Tri-County's website. I'm going to take us back to the homepage just so you can take a look at that. No matter where you are, you scroll to the bottom and our data page is here. This is the easiest way to navigate, but it's keeping yourself informed as an employer or employee, knowing what's happening within your community, making common sense decisions about what's a good fit for you and your business, and thinking through the activity that you're engaged in, and voicing your concerns when you have them, especially now when we see case counts going up. So I just want to show you this. So that's our data page. That is COVID-19 data. And we have a lot of information here. So I'm going to take you to the case dashboard, and everything from the number of positive cases. You can break this down by our data team put this together, and it's actually very fun to play around on this and kind of see how far you can narrow the information down and what you can see within your specific community and time period. So everything from those general cases, we have cases by county. It does get technical, all the way down to the amount of mask wearing that we're seeing across the county. So Tri-County has done something pretty innovative here within our environmental health division. We had folks go out into the community because as we were considering if a mask mandate was necessary and what benefit we've received from that as a community, we talked to folks who either said, no one is wearing masks, or everyone is wearing masks and we don't need it. And so we really wanted to be informed in our decision making. And what we saw was that a lot of folks are wearing masks. A lot of folks aren't. And the website isn't updated yet. And I'm so sad not to be able to show you, because this is the week of July 5th. This is right before any mask mandate was issued. And then the following week after the mask mandate, every county is in the 90% up to 97%. And so what we saw is a lot of people are wearing masks, that's true. And a lot of people aren't, so that's true too. And a mask mandate worked. We did see a significant uptick in the number of folks wearing masks in the community. So I do want to show you one more thing, and then questions. I want to show you the information on masks, because we've heard from employees, from employers, this is a really challenging issue for you all to tackle here. We know that folks don't want to wear masks always. You may not feel empowered to remove someone or deny services to someone who claims a medical exemption, or all kinds of issues that come along with this mask mandate for businesses. And so guidance for wearing masks here from that main page. There's some really great resources specifically for employers, including the civil rights guidance for employers and places of public accommodation. So this goes through what the requirements are, what language you can use in your conversations with customers about what the requirements are, what you need to do as an employer for your employees and customers. And I will just say that one of the things that we try to reiterate each time we talk about this is that businesses do have the authority to deny service to anyone not wearing a mask, even if they have a medical exemption. You are really encouraged to provide a reasonable accommodation. So curbside pickup, outdoor seating, to-go food or delivery. But at no point is do you have to let someone without a mask into your business. So lots of great resources here. We are working on Tri-County's website on our business page. We will have a script there for businesses to use with masking. And this is also something that we're happy to chat through with you as you encounter issues, and again, advocating to the state on what kind of guidance we need to fill these gaps and support all of you as employers and employees, because we know that this is intense and very politically charged, unfortunately, and can be trouble for folks. So we want to make sure that we're supporting you in that way. So reach out if you have questions about that. It will appear under this guidance page just in the next, tomorrow actually. So keep an eye out for that here. All right. That was a lot of talking. So with that, I'm gonna turn it over to questions, and I see them coming through here in the chat box. My employer wants everyone to come back to the office. They said people who are at high risk can stay remote workers. I believe I am high risk. I have health conditions and my child has severe asthma. My boss says I'm not high risk because he read that kids are safer and asthma isn't a big deal. Who decides, me or my boss? Can he fire me if I demand to stay remote? So this is a really complex issue and one we do hear a lot, just what the parameters are for accommodations here. I'd really encourage you to take a look through some of these resources that I referenced, the civil rights guidance here. And I'm actually, I did talk to Congressman Crow's office, and I will put together a one-pager with some of these links for folks that can be posted alongside this video. So keep an eye out for that because I'll post some of these main things. But this guidance for civil rights guidance, it includes in the workplace. So take a look through that. There are a variety of guidance documents through the Civil Rights Division, and I'm just trying to see if it's if their information is included here. But if it's not, I will I'll include that as a link. It's not easy to give a clear answer on that, but these documents will be supportive. I will say that businesses should still be operating remotely, and it is a requirement of the public health order for businesses to be operating remotely to the greatest extent possible. And so if your job can be done completely remotely, you are encouraged and your employer is urged to allow you to do that, especially if you've been doing that and can do so. So if you have questions, reach out to that, to our business reopening task force, business or COVID business recovery at tchd.org. We're happy to connect you with these resources here. They'll be in that one pager, but just reading through the documents, and then there are avenues by which you could bring an action if you thought that you were at high risk and weren't being accommodated appropriately. So lots of details there. It can get sticky, but there is guidance that can help facilitate that conversation with you and your employer or the state if you decide that that action is needed. Are gloves required for office employees? So this gives me an opportunity to mention that we expect a new public health order tomorrow. This will be 9th amended public health order 2028. I'm going to bring up this page since I'm still sharing my screen here. Hopefully I've been sharing it this whole time. This is where you can find the public health orders and executive orders. I mentioned the governor issuing those executive orders first, a public health order usually following. Both of them can issue orders independent of each other, but usually it follows that executive order, public health order. So you can find both of those here. This is going to be 9th amended public health order 2028, safer at home and in the vast great outdoors. We expect to see this tomorrow, and we expect it to touch on gloves, interestingly, because if you have looked through the guidance, you'll see that gloves are required generally throughout. And so it gets a bit confusing because it's not required for all things in an office setting. It is now recommended for your industry. If it is something that your industry usually wears gloves for, you should wear them. If you are passing things back and forth, you should wear them in those occasions. But no, you wouldn't be asked to wear gloves as an office employee more generally. Keep an eye out for that updated public health order. And then again, this really is a tool, you know, we're happy to help, but just to empower you to advocate for yourself, checking out these guidance for businesses, because guidance by sector here, you can go to guidance by sector, office-based businesses, and the requirements for office-based businesses specifically are outlined here. And so just a way for you to advocate for what the requirements are using this guidance information. So whether it's a conversation with your employer or employees or a conversation with us, feel free to check out these documents. Please do, actually. It really outlines the requirements based on a variety of settings. And I'll leave this up because you can see here to the left what those requirements are. What are the consequences for non-compliance with your rules? Will the police shut my business down if I don't make people use a thermometer every day? No. So it's really tough. What we're looking for, well, first, your local public health agency, Tri-County Health Department, is tasked as the primary enforcer of these orders. We do have support from a variety of entities, whether it be law enforcement. It's going to depend on the law enforcement agency's policies, what they respond to, what they engage in, and so it depends. But our law enforcement are responding to calls and certainly egregious violations of the order that really pose an imminent threat to the health of the community. So law enforcement is engaged. Our business licensing folks at the local level are engaged. Whether you're hearing communications from them, they've emailed you and let you know the current status, or they've issued you a warning or an order to close your business because you're not complying. Tri-County and all of these entities are focused on education first. So we know that our businesses are interested in complying, keeping their customers safe. And so it really looks like a conversation with us, just like we're doing here. Have you seen this guidance? Did you see they changed that last week? We expect a public health order. Looks like somebody's required to wear gloves every day in an office. We want to make sure that we're letting you know that you don't have to do that. The guidance has changed. It changed yesterday. It's changing tomorrow. Want to keep you informed about what that is. And we know it's changing. So no, you're not going to get in trouble for a slip up, for a misinterpretation of the order, making a good faith effort to keep your customers, employees safe as you operate your business. I will say there are some requirements here that really need to be in place. And so if you don't have them in place, you will hear from us about that. And if you're not willing to comply, it does look like further action, like a warning to let you know that you are in violation of the order and this is a requirement. Tri-County does have the authority to close businesses that pose a threat to public health. We have not had to do that very often under COVID-19 because we do gain voluntary compliance. Specifically related to your thermometer question, because it is specific and one that we get, it is not required in all situations, and it's tough to do these webinars without having a conversation. And again, just an opportunity to mention the Business Reopening Task Force, COVID Business Recovery at tchd.org, because we'd love to chat through your specific business and whether or not a thermometer is required. In most cases, symptom screening, like we touched on those best practices for all businesses, you have to symptom screen. You don't always have to take a temperature. So if you were not symptom screening at all, that would be a problem and something that we would chat through with you. If you can't get a thermometer or it's impossible for you to scan all of your employees before they come into work each day, we'll chat through with you what you can do in place. Can you get your employees to symptom screen at home before coming in? Or at our office, we have a website right as you walk in the door. It says, please symptom screen yourself. And we do our symptom screening right there. We scan the QR code and put in whether or not we've had symptoms. So we need that symptom screening every day, but we're happy to work with you on how that happens. And we're not interested in coming to shut your business down for violations or misinterpretations or inability to meet a requirement. We want to chat through what that can and should look like with you. If a patron in a restaurant refuses to wear a mask and a restaurant serves them and allows them inside, who is in trouble for breaking the code? the patron, or the restaurant. I hate to do this to you guys again, but it really is situational, and we'd love to hear the situation that you're in, and who, you know, what's the issue? Are there medical exemptions? Is it, you know, a miscommunication, or, but under the governor's executive order, and I'll just navigate to that really quickly, maybe. Under the governor's executive order, businesses are required to require masking in their establishment, and patrons are required to wear masks. And so there's really this onus on both the business and the patron of the establishment to wear a mask. The way we have it structured at Tri-County, and so this is how we're responding to our businesses, and just in general, we operate on a complaint basis. So we do get lots and lots of complaints, and so the community is interested in staying safe and healthy, and we hear from them. We hear from employees, we hear from employers across the board about this. But with masks specifically, there is a medical exemption. I mentioned this earlier, but a business is not required to allow a patron to enter without a mask. Looking for a reasonable accommodation there. Can they do curbside? Do you have outdoor seating that they could make their way to as opposed to indoors? And so looking for an accommodation there. But if we're hearing that a business is regularly not complying with the order, not requiring customers to wear masks, customers feel comfortable not to comply because a business has implied that they don't, we'll respond to that. And honestly, sometimes, you know, if we get 3 complaints, 4 complaints on a business, people aren't masking here, we follow up. What's the barrier? I mentioned an employer may not be requiring masks, may have taken an extreme approach and said we don't wear masks. That's really where we're looking to gain compliance, let them know, look, this is serious, you can't do that. This is the requirement of the order, maybe a warning, and we usually gain compliance that way. Lots of times it's a lack of resource, lack of knowledge, lack of knowledge of a change that recently happened. We touched on that. And so lots of education, connections to resources. The Business Reopening Task Force will be doing a mask project with the business community, connecting some businesses in need of masks with those resources free of charge. So really exploring different ways. Of course, we have limited resources, but connecting to other resources, providing template signage, you know, with the Tri-County logo, so they feel confident that this is coming from the health department, not just my random restaurant put this is making me do this. This is a public health order. It's the law, and you need to require. So, you know, a variety of ways to deal with that, but not looking to penalize folks, looking to educate, making sure folks are connected to resources, and gaining compliance through that route. My employee printed a card off Facebook that says she has a health condition and I can't make her wear a mask. I know I can't ask her to tell me about her health conditions, but I have seen the card on Facebook too, and it's totally bogus, right? So I encourage you to take a look at that civil rights guidance. Again, I'm going to send over a 1-pager to be posted with this video, so you can get connected to this quickly. But it is on the state health department's website, that main website, covid19.colorado.gov. But it's the civil rights guidance, and employers actually can ask for documentation of a disability that requires an accommodation in the workplace. And I don't want to get into too many details because I'm not the appropriate messenger of that information, but the state has outlined it here, and it's different for employees that are asked to make a reasonable accommodation. I will say, depending on the industry that you're in, if your employee can't wear a mask, there are situations in which they cannot have direct contact with the public or coworkers. And so those requirements are under the industry specific guidance that we touched on earlier. But retail is an example. If you're a retail worker at your grocery store and you medically cannot tolerate a mask, you should be doing a task that does not involve direct contact with the public or your coworkers to ensure everyone's safety in that situation. So check out the Civil Rights Guidance, CDPHE's website, but feel free to reach out to our Business Reopening Task Force as well. I'm happy to chat through that with you. Coworkers keep wearing masks under their nose and they are breathing all over me and my space. Do you have any facts that I can show them about how the mask needs to cover their nose or it's useless? Yes, we do, because you are not alone in that concern. So I'll take you to the State Health Department's resource. Tri-County also has resources on mask wearing. Going to go down to this mask update here, mandatory in all public spaces, fast facts, masks should, and here it tells you that it should fit snugly but comfortably against the side of your face. It should be secure. There's some FAQ information in here about the importance and what masks do. I will say, if you reach out to us, we're happy to connect you with some of the science, just maybe some diagrams on how to wear a mask, but check out these resources because there's a lot of good information here. And then this looks like the last question here. If masks work, why did Tri-County Health wait until now to make a rule? You know, this is a tough question, and we labored over this intensely for quite some time because there's a balance here. We want to respect people's wishes as far as what they do with their body and whether or not they wear a mask. We did see fairly high rates of mask compliance, and that is where that survey that I referenced a bit earlier, where that monitoring came from, because we wanted to know what really was happening within the community. And so we saw compliance rates in the 80%. We talked to our local governments. What's really important with a mask mandate is collaboration between our local governments who are really within the community very regularly throughout their regular jobs, whether it be their government buildings, their parks and rec folks, their business licensing, courts, etc. Having buy-in from those folks that it's going to work for them, that they're going to put up signage, they're going to take this seriously and help us achieve this greater risk offset through mask wearing. So there were conversations about it, needing this local support to gain compliance and spread the message with us about mask wearing. And then we ultimately got mask wearing messaging from the state, which really helped spread the message far and consistently. And we had been asking that of the state, and we're very happy when the governor issued that, just making it easier for folks to understand. One-stop shop, you know, this is the requirements. Although I'll say in the Tri-County jurisdiction, there's masking requirements outdoors. That's our additional provision there. So there was a lot of thought. We wanted to be thoughtful in that decision in making such a big decision from your local public health agency. And so we wanted to be sure and consistent with our messaging and regionally. And so a lot of thought went into it. But I appreciate the question and I'm happy to chat more if you'd like to. Okay, well, thank you guys so much for having me. This has been really fantastic. I appreciate all your questions. Reaching out again to the Business Reopening Task Force, COVID Business Recovery at tchd.org. Happy to answer your questions as you navigate, whether you're an employer, employee, concerned parent, we hear from those too. Feel free to reach out. We would love to connect you with resources and provide education, and just thank you for participating. Thanks.